Alcohol-related liver disease, P1. Alcohol-related liver disease is liver damage caused by drinking too much alcohol for a long time. In general, the amount of alcohol consumed, how much, how often, and for how long, determines the risk and severity of liver damage. Symptoms range from none at first to fever, jaundice, fatigue, and a tender, painful, and enlarged liver, then to more serious problems such as bleeding in the digestive tract and deterioration of brain function. To help identify whether drinking is a problem, doctors may give the person a questionnaire and ask family members how much the person drinks. If people who have been drinking in excess have symptoms of liver disease, doctors do blood tests to evaluate the liver and occasionally do a liver biopsy. The best treatment is to stop drinking alcohol, but doing so is very difficult and requires help, often in rehabilitation programs. About 8.5% of adults in the United States are estimated to have alcohol use disorder in any given year. About twice as many men as women abuse alcohol. See also alcohol. Most alcohol, after being absorbed in the digestive tract, is processed, metabolized, in the liver. As alcohol is processed, substances that can damage the liver are produced. The more alcohol a person drinks, the greater the damage to the liver. When alcohol damages the liver can continue to function for a while because the liver can sometimes recover from mild damage. Also, the liver can function normally even when about 80% of it is damaged. However, if people continue to drink alcohol, liver damage progresses and may eventually result in death. If people stop drinking, some damage may be reversed. Such people are likely to live longer. Abuse of alcohol may cause 3 types of liver damage, which often develop in the following order. Accumulation of fat, fatty liver, or hepatic steatosis. This type is the least serious and can sometimes be reversed. It occurs in more than 90% of people who drink too much alcohol. Inflammation, alcoholic hepatitis. The liver becomes inflamed in about 10 to 35% of people. Cirrhosis, about 10 to 20% of people develop cirrhosis. In cirrhosis, a large amount of normal liver tissue is permanently replaced with scar tissue, called fibrosis, which performs no function. As a result, the internal structure of the liver is disrupted, and the liver can no longer function normally. Eventually, the liver usually shrinks. People may have a few symptoms or the same symptoms as those due to alcoholic hepatitis. Cirrhosis cannot be reversed. Cirrhosis. Cirrhosis can cause the following serious complications. Ascites, fluid may accumulate in the abdomen, causing swelling. Hepatic, portosystemic, encephalopathy, brain function may deteriorate because the damaged liver is less able to remove toxic waste products from the blood. People may become drowsy and confused. Portal hypertension, the vein that brings blood to the liver may be narrowed or blocked, increasing blood pressure in that vein. Portal hypertension causes or contributes to ascites, bleeding in the digestive tract, an enlarged spleen, splenomegaly, and sometimes portosystemic encephalopathy. Bleeding in the digestive tract, veins in the esophagus and stomach may enlarge and begin to bleed because of portal hypertension. People may vomit blood or have bloody or dark, tarry stools. Liver failure, the liver becomes less and less able to function, resulting in many complications and generally failing health. Liver failure can eventually lead to kidney failure. Bleeding disorder, people tend to bleed and bruise more easily because the damaged liver does not produce enough of the substances that make blood clot, coagulate. Also, alcohol can reduce the number or activity of platelets, which also help blood clot. Portal hypertension leads to an enlarged spleen, which also decreases the number of platelets. Enlarged spleen. Portal hypertension causes the spleen to enlarge, a condition called splenomegaly. The enlarged spleen traps and destroys more white blood cells and platelets than it normally does. As a result, the risk of infections and bleeding is increased. Risk factors of alcohol-related liver disease. Alcohol-related liver disease is more likely to develop if people drink large amounts of alcohol, have been drinking a long time, usually for more than 8 years, are women, have a genetic makeup that makes them susceptible to alcohol-related liver disease, are obese. Alcohol consumption. People can understand their risk of alcohol-related liver disease more precisely if they know how much alcohol they are drinking. To determine how much they are drinking, they need to know the alcohol content of alcoholic beverages. Different types of beverages contain different percentages of alcohol. Beers, 2 to 7% in most. Wines, 10 to 15% in most. Hard liquors, 40 to 45% in most. However, in typical servings of these different types of beverages, the amount of alcohol is similar even though the amount of liquid is very different. A 12-ounce can of beer, about 1/7 to 4/5 ounce. A 5-ounce glass of wine, about 2/3 to 1 ounce. A 1.5 ounce shot, or typical mixed drink, of hard liquor, about ½ ounce. In hard liquor, the alcohol concentration is often described as proof. The proof is about twice the percentage of alcohol. For example, an 80-proof hard liquor contains 40% alcohol. For men, risk increases if they drink more than about 1.5 ounces of alcohol a day, especially if they drink more than about 3 ounces, for more than 10 years. Consuming 1.5 ounces a day involves drinking about 3 cans of beer, 3 glasses of wine, or 3 shots of hard liquor. For cirrhosis to develop, men usually must drink more than about 3 ounces of alcohol a day for more than 10 years. Consuming 3 ounces a day involves drinking 6 cans of beer, 5 glasses of wine, or 6 shots of liquor. About half the men who drink more than 8 ounces of alcohol a day for 20 years develop cirrhosis. Generally, the more and the longer people drink, the greater their risk of alcohol-related liver disease. However, liver disease does not develop in every person who drinks heavily for a long time. Thus, other factors are involved. Sex. Women are more vulnerable to liver damage by alcohol, even after adjustments are made for smaller body size. Women are at risk of liver damage if they drink about half as much alcohol as men. That is, drinking more than 3/4 to 1.5 ounces of alcohol a day puts women at risk. Risk may be increased in women because their digestive system may be less able to process alcohol, thus increasing the amount of alcohol reaching the liver. Genetic makeup. Genetic makeup is thought to be involved because alcohol-related liver disease often runs in families. Family members may share genes that make them less able to process alcohol. Obesity. Obesity makes people more vulnerable to liver damage by alcohol. Other factors. Accumulation of iron in the liver and hepatitis C also increase the risk of liver damage by alcohol. Iron may accumulate when people have hemochromatosis, a hereditary disorder that results in absorption of too much iron, or when they drink fortified wines that contain iron. However, iron accumulation is not necessarily related to how much iron is consumed. More than 25% of heavy drinkers also have hepatitis C, and the combination of heavy drinking and hepatitis C greatly increases the risk of cirrhosis. If iron has accumulated in the liver or if people have had hepatitis C for more than 6 months, the risk of liver cancer, hepatocellular carcinoma, is increased. Let me know what do you think. Looking forward to your comments.